All right. So, what is the number one cause of dry eye disease? Dry eye is a significant player in the field of eye care. It's something that affects so many people. It's something that I've struggled with since I was a teenager. Not only will dry eye contribute to a feeling of irritation and dryness on the surface of the eye, but it can contribute to a feel of like a foreign body sensation. It can contribute to redness of the eyes, as well as a fluctuating part of your vision, like your vision will fluctuate in between blinks. You can even paradoxically have tearing of the eye, where your eyes are dry and you're reflexively creating tears to try and fix the problem itself. And then for some people, their dryness can become so severe that their vision blurs and it can even become painful. So, in today's episode, in this education, we're going to be going deep into the number one cause of dry eye, something called Meibomian Gland Dysfunction. And let me know right now if you're catching this live or on the replay, if your doctor has ever told you that yes, you have dry eye, but that you specifically have Meibomian Gland Dysfunction or MGD. Now, if this is your first time here to the Dr. Eye Health channel and to our live streams, my name is Dr. Joseph Allen. I'm the host here on the Dr. Eye Health channel, and we have a lot of information covering dry eye, as I personally have had more of an interest and specific study in this since I was even a student and a resident finishing my education, as I myself, again, have had dry eye since I was probably in my early teenage years. Now, with this tonight's live stream, I wanted to go deep into meibomian gland dysfunction because I've had a lot of patients with this condition, and they always ask me, "Hey, what caused this? Why did I start to develop this?" And usually in the eye clinics, your doctor, including myself, sometimes we don't have enough time to go into this as extensively as we are this evening. So please let me know. Let us know in the chat if you're again here live or again on the replay. Just let us know your experiences with dry eye and if you've ever been told or heard of meibomian gland dysfunction before. Without further ado, let's dive in. We're going to start off just kind of reviewing what's called a vicious cycle of dry eye. I'm not going to spend too much time on this because we've covered it in some previous episodes, but dry eye is very complex. There's many factors that contribute to dryness and an unstable tear film and all the many symptoms. But just I wanted to show this to kind of exemplify how complex it can really be. But within how complex this is, I think most people would instinctively think, oh, if I have dryness, it's just that I don't produce enough tears. And this can be the case for some people. Usually this is because of autoimmune conditions, maybe aging and hormone changes, systemic medications, or neurological causes can contribute to this. However, research shows that tear volume problems only account for about 14% of cases of dry eye. The other major components have to do with tear evaporation or the loss of tears, whether that be from true evaporation due to the environment, like low humidity or temperature. It could be due to other factors like tear film instability, or if you have used a lot of eye drops with preservatives, there's a lot of factors that come into play. One major part of that is the meibomian gland dysfunction, which we're going to touch on. To really help better understand how the tear film works, this is kind of a simplified diagram of the tear film. We think of it as having three major layers. The middle layer, which is the largest, we call the aqueous layer. The aqueous layer is the liquid component of the tears and has a lot of electrolytes and other proteins that float around in it. Below that, there's what's called the mucus layer or mucin layer. And this is the mucus that's produced on the surface of the eye that really helps bind. It's like the glue that holds the liquid to the surface of the eye. But then there's this outer layer called the lipid layer. This is an oil that floats on the surface of the tear film and prevents the tears from just evaporating into the air. Now, this is, again, a simplified diagram. In more modern thought, it's believed that all of these three layers are sort of a little bit mixed together. But think of the lipid layer of how important that is. Because if you've ever cooked like maybe noodles in a pot of water and it's boiling, you can add a little bit of olive oil to it. That oil floats on the top. And so we think of that as creating that seal in the tear film that prevents that tear from just evaporating. So when we dig into the research, about 50% of all cases of dry eye disease are related to the evaporation of these tears. That's how significant it is. 50% of everybody. The worst cases, people who have a mix of both the evaporative and they're deficient in the tear film, like the aqueous deficient, those are people who have mixed cases. And usually those really are the most severe cases of dry eye. And then again, we have about 14% of people that just aren't producing enough tears. I know I see some questions coming through, so thank you guys so much for being here. We will be doing some live Q&A toward the end, so please stick around, and I'll see if the best we can do to answer all of your questions. So the number one cause, as I've mentioned before, to dry eye disease is Meibomian gland dysfunction. That's the number one cause for causing poor problems with evaporation of the tear film occurring. We call this MGD for short. And so what you see here is an image of a really angry eyelid. This is a lower eyelid of a patient who has inflammation in that lid. You can see some small blood vessels that are dilated, making it look red and inflamed. And then you can see all these little white bumps, and those kind of may resemble like pus coming out of a pimple, for example. And that's what bad Meibomian gland dysfunction looks like. And so we're going to dive a little bit deeper into this. So on the surface of the eye, if you were to look, at your friend's eyelid when it's closed, if you could use some like X-ray technology and look through the tissues, you'd be able to see that they have these little vertical glands running up and down on both your top and bottom eyelid. There's about 20 to 30 of these glands on both of the top and the bottom. And if you came into the clinic, like at our clinic, we have some infrared imaging technology that a lot of clinics are starting to acquire, thankfully, but it allows us to image these glands and see how many somebody has. Unfortunately, some cases, some people's glands have slowly started to die off. Either they start to become inflamed, they stop producing very much, they become kinked or truncated, and some glands can even completely atrophy and die off. And this is a huge concern because some people, we're starting to see not only this occur in people who are a little bit older age, but we're seeing this at even younger ages, even teenagers. So it's a significant thing that we're paying more attention to. Even for clinics, for doctors and clinics that don't have infrared imaging technology we call meibography, even turning the eyelid inside out here, we'll pull the eyelid down, you can see that the glands there are not really extensive. They're just small nubs. So this person probably has pretty significant Meibomian gland dysfunction as well. When we press on the eyelid, and eye doctors will usually do this, we'll push just for a little bit on the eyelids, both the bottom and the top eyelid, testing to see the glands express. In this case, let me just start as saying that if you imagine a 12-year-old, perfectly healthy 12-year-old, no problems, and if I push on those eyelid glands, I expect the oil to come out clear, almost like water. That would be like super healthy. But as somebody develops Meibomian gland dysfunction, there's more inflammation in those oils. As I push on it, the oils may start to come out like a yellow color, or the kind of milky, where they have individual like proteins. You can almost see it floating in the oil. That's kind of what this image looks like. As it progresses, as Meibomian gland dysfunction gets worse and the quality of the oil starts to solidify, and that's what we find is the more inflammation that occurs in Meibomian gland dysfunction, that the oils themselves, they start to solidify and become almost like waxy esters. And so when you push on the lid here, we'll use a special tool to clamp on the eyelid, it'll start to pop out again, kind of like expressing a pimple. So on the surface of the eye, this plays a significant role because imagine a perfect, healthy, like 12-year-old's eyelids. If we put a little fluorescein sodium, this is a special yellow dye that your doctor may put in the tear film when they're evaluating you for dry eye. On the left side here, that surface of the eye looks pristine, just very smooth, solid, kind of a green color. That person has a very stable tear film. But on the other side, it can look really kind of cloudy. I think of it almost like the way clouds look like they're spiraling on like a global view of like storms that are brewing around. That's where the oils have started to separate and break free, and then it's exposing the tear film underneath and evaporating much quicker. And so we call that a tear breakup time test, and it's something that we typically measure during not only sometimes routine exams, but usually during dry eye evaluations. All right, so I know we've covered a lot of these sort of things, but back to the main point of what we wanted to talk about tonight is why. Like, Meibomian gland dysfunction is very common. 50% of everybody, plus the component of the 36% of people who have the mixed component. So what causes MGD in the first place? So there's many different causes. And I know this always frustrates me when I read into research, and they always list aging as number one. And I don't know if that's just because of alphabetical reasons, but it does play a significant role. We do see Meibomian gland dysfunction occur more frequently in older individuals. This is believed because our cells do age and the gene expression does start to decrease. This eventually stops your oil glands from producing very well. It also prevents not only not producing as well, but it also leads to gland atrophy. And there's some components to this. Now, the good news is that there are some new treatments that are coming out that are showing some evidence that we can help these cells improve their vitality. And I can't say it's reversing aging, but it is at least halting it, or kind of supercharging the cells to start producing and maybe prevent some of these negative effects that include the atrophy of the glands, as well as helping them secrete a little bit better. And we'll touch on that in just a little bit. Hormone changes. This is a significant one. This is something that there's quite a bit of research into the hormone changes that contribute to Meibomian gland dysfunction. So androgens, this is testosterone, but androgen receptors have been located in the Meibomian glands themselves. And that makes sense to some degree, because if you think about the oils of your face, when you're like a teenager and you go through huge hormonal shifts, a lot of kids do what? They break out in like cystic acne, they get really oily faces. And as you go through your lifespan, again, as we age, hormones also fluctuate. And again, the oils you produce on your skin and your face change as well. And so there are androgen receptors in the Meibomian glands. And what they found is that typically people who have lower amounts of testosterone have decreased production of the meibum. The oils just aren't producing as much. And then they also have found that, sorry, there's a loud truck going by. There's also keratinization, which is the kind of the scaling or buildup of dead cells that are clogging up the Meibomian glands themselves. So not only are you not producing enough oil, but the glands become clogged to the point where the oils aren't even able to get out. And so that's another component that has to do with hormone changes. And the hormone changes maybe play a more significant factor for women who are going through menopause, because that's, again, another huge shift in the estrogen testosterone levels. As far as some people who have too much testosterone, it is theorized that those individuals may produce too much meibum, too much of the oil from the Meibomian glands. And there are cases of this. However, it's not super common. Environmental stress. This is another part. And this, I think, maybe plays a role even in somewhat of my own Meibomian gland dysfunction that I've struggled with. And this has to do with chronic exposure to low humidity. This may play a role if you're somebody who lives in a dry climate, like out in a desert, like I was just in the Arizona desert just earlier this week. And in Minnesota, where I live and practice, it is super cold here. And so in the cold winter months, the air is also really low. The humidity is very low outside, but then you come inside and we have the furnaces on all the time, where humidity again is super low. And the chronic exposure to low humidity has been found to affect ductal dilation. It can contribute to gland atrophy. And then there's even a thought that it contributes to hyposecretion as well because of these factors. So humidity also may play a significant role. This one, eyelid microbiome. This is also really fascinating. This is something that even as a young student, I was aware of a condition called blepharitis. Blepharitis is actually pretty common. I think it's actually mild forms of blepharitis are probably far underdiagnosed. blepharitis in this microbiome, this is really the bacteria and microorganisms that live on your eyelids and your eyelashes. There is believed to be kind of a normal amount of bacteria that are just living on your skin that can be helpful. But a lot of people have an overgrowth around the eyelids because most people just don't clean around the eyes very often. We avoid it with water and soaps because that will cause irritation. The problem is that this bacteria, when it builds up on the surface of the eyelids and mixes with the oils of the meibomian glands, they produce lipolytic enzymes that end up breaking down the oils, and they release inflammatory mediators, which cause redness, inflammation, and contribute to these oils kind of in a way solidifying. And again, you have all these issues with MGD. Another major factor is Demodex blepharitis. And let me know again in the comments if you've ever heard of Demodex. We've done a few videos on it, but it's something that people I think are becoming more aware of. Demodex is a small mite, and I don't mean to gross people out, but it's a small mite that naturally lives on our skin. There is a couple of different types that love the eyelashes and around the eyelids. And these mites, if you see this one image we have here, you can see all these yellow crusts building up on the edge of these eyelashes. These we call collarettes, and that's pathognomonic for Demodex blepharitis, for a overgrowth of these small little mites that are burrowing into the eyelash follicles. When there is this high amount of Demodex, there is a dramatic increase in inflammation and disruption of these oils that are being produced, because a lot of these little mites, they eat the oils. And so that it causes a lot of this inflammation, and have a strong association with Meibomian gland dysfunction. Another strong association is rosacea. So individuals who have face like acne rosacea on their face, but also ocular rosacea specifically. There's about 92% of patients with rosacea also have Meibomian gland dysfunction. And then again, there's a strong association with Demodex with rosacea as well. So another potential cause. Medications. There are a few medications that contribute to Meibomian gland dysfunction. Oral medications such as isotretinoin or Accutane, as that is one that's been well known, and we did a video on that not too long ago. And there is some theories that retinol creams may also contribute to this. I went more extensively into that research in that video, and if that's something that you've ever been on, or maybe your doctor and you are talking about maybe going on a medication like that, I encourage you to just check out that video. I'll put a link to it in the description below. But I cover that information and really the details of the research more extensively in that video. Topical medications. If you've ever been put on glaucoma medications like eye drops, almost not all of them, but most of them have been shown in the research to contribute to Meibomian gland dysfunction. And then eye drops, including medication eye drops, as well as over-the-counter eye drops for just even dryness, that have preservatives, specifically a preservative called BAK, or benzalkonium chloride. And I've mentioned this in a lot of other videos, but that preservative, while it's a great preservative, unfortunately has also been linked to contributing to Meibomian gland dysfunction. And that's one of the reasons why, if you do have dry eye disease, if you've ever struggled with that, most eye doctors will recommend going to a preservative-free formulation, or a formulation that is known to have a soft preservative. There are several different brands that have a soft preservative. If you're not sure, I have done videos on specific eye drops that I recommend, or that many doctors kind of think are some of the best ones out there. Contact lenses. This one I've always been pretty interested in, again, because I was a contact lens wearer from the age of 13. It's one of the reasons I even became an eye doctor, because contact lenses changed my life. The research is really mixed. There are some studies that say, yes, there's a strong association between contact lens wear and Meibomian gland dysfunction, but then other studies say, nope, there's really no connection. The theories of why, of how that could be related, the thought is that the lens themselves may cause a mechanical obstruction or damage to the edges of the eyelid as you're blinking or it's moving around, that the dryness that contact lenses contribute to on the surface of the eye, because the contact lens disrupts the tear film and quickens the evaporation rate of the tears. And so that may raise the inflammation that's occurring on the tear film, and that may, again, contribute to meibomian gland dysfunction. And then there's even a theory that people who are wearing contact lenses experience more dryness. And so the meibomian glands, people are blinking to fix the dryness. The meibomian glands are secreting so much that perhaps the meibomian glands have secreted everything they can, and now they're slowly dying off because of that. Almost like they've emptied out their oil cells and now they're slowly dying. That's one theory. But still, studies are kind of mixed. Makeup. This one, I think, had a little bit more interest in it in the profession of eye care. If you were to go to different conventions, like I go all throughout the country, there are definitely several doctors who are presenting on this, both in research as well as just kind of summing up the concerns that we have, both that there are ingredients in makeup that are contributing to meibomian gland dysfunction, as well as some practices such as tight lining or water lining, where people are putting makeup right on the edge of the eyelid, and that may be blocking the glands and contributing to meibomian gland dysfunction. Now, we did a live stream a few months ago here on the Dr. Eye Health channel on makeup, and we had a special guest of Dr. Laura Perriman, who is not only a great mentor to me, she's one of the brightest minds in the dry eye space, and she does a lot of research, and I consider to be one of the leading authorities in makeup and its relationship to dry eye. And so if you haven't checked out that or caught that live stream, again, we'll put a link to it, because you can learn a lot about makeup and what type of what kind of ingredients to look for and what are considered kind of eye safe makeups. There's this other kind of theory, and that has to do with screen time. And this would make sense because we're seeing so many young kids developing meibomian gland dysfunction as well. As we are, as a society, we're using so many more computer screens, phone screens. I know when I wake up in the morning, the first thing I look at is usually my phone, right? Thankfully, I've now tried to get away from keeping my phone in the bedroom. I try to leave my phone out in the living room, and I have an old analog clock, so I'm not just, kind of allured by my phone all the time. But there seems to be a strong association with screen time and the development of meibomian gland dysfunction. However, the studies, again, are pretty mixed. But there are some studies even on young children and having higher rates of this meibomian gland dysfunction. Kind of the theory of why has to do with when we're on a screen, we don't blink as often, and we also don't completely blink. And the oil glands blink more, or the oil glands release this oil when you completely blink. So if you're not blinking as often and you're not completely blinking your eyes, then those glands really aren't triggering as well, and you're not releasing as much oil. There's also some parasympathetic signaling, some neural signaling that goes to the glands. And there's theories that the increased amount of screen time and people being sedentary, it's changing the parasympathetic tone, and then we're just not releasing as much oil. So different theories, but still more research is needed. So those really are the major causes of meibomian gland dysfunction, which, again, for myself, I'm thinking, wow, as a kid, I spent a lot of time playing video games and staring at screens. I wore contact lenses. I lived in a low humidity area for long periods of time. And so they all can contribute to meibomian gland dysfunction. And I'll admit, as a kid, how often did I clean my eyelids? I had no idea about blepharitis or what was going on there. And so I think all of these different things have probably helped pile up and contribute to even some of my own issues with meibomian gland dysfunction and dry eye. So treatments. This is probably one of the, again, the biggest things I spend a lot of time in the eye clinic talking to my patients about, is just breaking down the treatments that I recommend for them, what their options are. So no matter what, if you're somebody who struggles with dry eye and meibomian gland dysfunction, it's still, you should talk to your eye doctor to get in kind of the, not only an appropriate diagnosis, but for them to give their recommendations for proper treatment. The ones I'm going to be listing here is just for educational reasons. I just want you to be aware of what's out there, kind of what the research is showing, as well as just my anecdotal 2 cents about what kind of results I see in the clinic. So the first ones I like to talk about are conservative lifestyle, or sort of things people can do just at home on their own. This includes trying to decrease screen time, which I know is challenging, frequent blinking. And this one is published, but It's tough to do. I think it's really just I think it's good for people just to be aware that they may not be blinking very much, especially while using digital screens. And I think just being aware that, hey, if they're having dryness symptoms, especially on a screen, oh, maybe they need to blink their eyes a little bit more. Optimizing work and home environments would include having like humidifiers and just being aware of any sort of wind, or if you have a fan or air conditioning vent that's blowing directly toward you, maybe trying to rearrange your home office or your home environment so that you don't have those sources of increased evaporation and dryness. Daily eyelid hygiene. Again, blepharitis, or this buildup of bacteria and oils that can build up on the eyelids, this can contribute to inflammation and is believed to contribute to the Meibomian gland dysfunction. Just cleaning the eyelids every day. There are many different types of eyelid cleaning solutions out there. This happens to be a new one that I just kind of showed off because they came up with a this is from Tear Restore. They came up with a really nice, like, natural biodegradable tissue that also has Manuka honey in it, which I've done a video on Manuka honey as well, but that also has some pretty amazing kind of benefits for cleaning the eyelids, as well as helping reduce redness and other factors that relate to dry eye. But again, many different products on the market, and we'll put some of my favorites in the description. Warm compresses. I've also talked about this for a long time. This might be the two basic things that most eye doctors will mention at any routine exam if they see some signs of Meibomian gland dysfunction. This is doing heated compresses on the eyelids for about 5 to 10 minutes at a time. Some research suggests going a little bit longer, but around 10 minutes is usually what's recommended. There are various warm compresses on the market. Here are just two of the more popular ones. You have the ones where you put in the microwave. There's some that you don't put in the microwave, but you heat them up and you close your eyes, put it on the top eyelids. And the theory is that that heat will melt the solidified oils that are trapped in the gland so that they can start running smoothly again. Some people are even encouraged to do this more frequently than once a day, but typically just for at-home lifestyle treatments, maintenance therapies, doing eyelid cleaning on a daily regimen, and then warm compresses every day, at least once a day, is also recommended. Tear Restore, I've also done a video on that one. That's one where the eyes are open. It was kind of nice just because you're able to still walk around and do things like answer emails or make breakfast, those sort of things I like to do. Omega-3 consumption. This is one I've also loved to talk about. And if you've caught the live stream we did last month on eye and vision supplements, or if you've seen the previous videos I've done on omega-3s related to dry eye. But this one specifically, I've tried to dig in if omega-3s specifically help Meibomian gland dysfunction. There are mixed results in the studies. Some studies do suggest, yes, it helps with Meibomian gland dysfunction. I've noticed improvements in my own Meibomian gland metrics in the clinic when I started supplementing with omega-3s. But some studies suggest, no, there's really no significant effect. And so it's still kind of up in the air, but I think most eye doctors will suggest that, hey, there's probably a benefit to taking omega-3s, at least for the symptoms of dry eye. But as far as Meibomian gland dysfunction, based on the mixed research, I just want to be transparent that it's still something that's debated in the profession. Medications. So topical azithromycin, this is an antibiotic that unfortunately can get a little expensive, but this has been shown in research to help with reducing inflammation, killing off any surface bacteria on the surface of the eyelids. Great for treating blepharitis. That has been used and shown in the research. Oral tetracyclines, or what's called doxycycline, is prescribed sometimes at a lower dose, not just as an antibiotic, but mainly for some anti-inflammatory effects and how it can change the oils that are being produced in the skin glands, including the Meibomian glands. So that has been around for some time. The one concern I personally have about taking oral tetracyclines or oral doxycycline for a long time is that we know that it could disrupt the gut microbiome. And there's also some interesting research on the gut microbiome and its effect on not only dry eye, but other eye health conditions. So I think I largely have pulled away personally from prescribing oral doxycycline, but it's something I do still offer my patients and have that discussion with if it's something that they if it's kind of comes down to like we have to consider taking that. Topical cyclosporin, there is some publications. Cyclosporins and many different eye drop medications now. The famous ones is Restasis. We have Cequa, and then we now have Vivi, which are all cyclosporin medications. But there is some publications showing that that can help with meibomian gland dysfunction. Topical steroids, that helps reduce inflammation in general on the eye. I do see some improvement in like eyelid redness and some just general inflammation within the tear film, but I don't usually see a dramatic improvement in meibomian gland dysfunction with steroids alone, because usually meibomian gland dysfunction is a chronic condition, and usually we don't like to prescribe topical steroids chronically for many, many years or months, because that has an increased risk of not only infection, but problems like cataracts and glaucoma issues. So we're always really cautious about prescribing steroids for too long of time, but doctors may prescribe it as a pulse, like a few weeks, just to calm symptoms down and bring down redness or inflammation in the lids. The last one I listed here is called Tyrvaya. Tyrvaya is a nasal spray, and I've done a video on this when it first came out, but Tyrvaya is a varenicline, and it is something you spray into the nose, coats the inside of the nose, and it communicates and sends a chemical signal through your nerves to your lacrimal gland to produce more of your own natural tears. But there's also a signal that we know that travels to the meibomian glands. And while the preliminary studies, the studies for the FDA trials, did not report how much the oil glands really produce, I have seen improved metrics for oil production for a lot of my patients who've simply started taking Tyrvaya. Again, I can't claim it'll work for everybody, but it's something I think I've seen a lot of success with, and I've heard other doctors find success with Tyrvaya as well. This medication is just been approved in this last year, called Xdemvy. This is lotilaner. It's an ophthalmic solution specifically to treat Demodex blepharitis. But we know, again, there's that strong association between Demodex blepharitis and meibomian gland dysfunction. And so thankfully, this is a medication you use twice a day for 6 weeks. And I think it just works outstanding. So I have many patients where as soon as I see collarettes like this building up on the lashes, I'll say, hey, there's a lot of work we can do with dry eye and meibomian gland dysfunction, but let's start here. Let's clean the surface. Let's get rid of this Demodex infestation. Let's start there. And I have a lot of patients who notice just dramatic improvements in their redness, in their burning, dry, itchy irritation of their lids, as well as their dry eyes. So probably just because we're clearing out the Demodex, and a lot of the inflammation that's contributing to the meibomian gland dysfunction is decreasing. In-office procedures. Now, there's a few different in-office procedures, and I find incredible success. I think if someone's looking for, like, I want the treatment that's going to bring me the fastest results in a short amount of time, it's going to be some form of one of these office procedures. Thermal pulsation has been around for some time, probably 15 going on 20 years. This is where we have devices in the clinic. One of them is called LipiFlow. You can see on the image here. There's several other brands. iLux, I've done a video on that one. And then there's TearCare as well. This is heating the eyelids and getting those meibomian glands to the oils that are trapped to melt. And then doctors, either some instruments like LipiFlow and iLux have a compression device built in that squeezes the glands and gets the now liquefied meibum out of the gland. Otherwise, some procedures, doctors will come in with a little tool and will express the glands that have now, hopefully, those oils have been melted. As far as thermal pulsation, the research, about 80% of people who have that procedure even once will notice benefits lasting at least 3 to 6 months. Some patients even over a year. I have talked with other doctors who see such great success with this, but they often don't just recommend it once or twice. They'll even have patients back and do it every few weeks. They'll do some form of a thermal compression or pulsation treatment every 2 weeks until the oils start just running clear, till they don't clog back up. And then once they see them running clear after 2 weeks, they'll stretch it out to 3 weeks. And after 3 weeks, and once it starts running clear, they'll stretch it out every 4 weeks. And they'll keep doing that until the oils just constantly run clear. And they've reported really good success with it. With that being in mind, sometimes price is a factor for thermal pulsation. I've seen prices go anywhere from being in the $300 up to $1,000 range, because a lot of these instruments, like let's say for LipiFlow, for example, doctors have to purchase new instrument pieces for every single patient they treat. And so that unfortunately contributes to the cost of your doctor even offering that procedure. So sometimes price can be a factor for those. Intense pulse light, or IPL. And there's several different devices that are available now. One of the most famous ones that got FDA approval was called the OptiLight through a company called Luminous. And I did a video on that with Laura Perriman, even Dr. Laura Perriman, when that got FDA approved. And that was posted maybe 2 years ago. And so we'll also have that video if you want to check that out. But intense pulse light works through using a polychromatic light. So it's a lot of wavelengths of light at a really high kind of pulse dosage to a specific treatment area on the skin. And with this light treatment, it does activate something called photobiomodulation, which in a way revitalizes the cellular tissue and kind of, in a way, I'll say, juices it up. It gets it to work better, and this helps reduce inflammation. In addition, IPL also causes photocoagulation, which burns off irregular blood vessels that tend to develop along the eyelid margin and on the face. This is really good for patients with rosacea, but this will burn off those irregular blood vessels and reduce the amount of inflammatory proteins that are getting to those tissues. And then it also has a bit of a heat effect. So the heat also helps melt the oils. And it's been shown that even IPL can kill off microorganisms, including Demodex mites. So this happens to be one of my favorite treatments. I think for best bang for your buck, it can get expensive. It can be upwards of like maybe $400 per treatment. And usually it's at least 4 to 6 treatments to follow the FDA guidelines. But I think it's one of the best bang for your bucks. I see a lot of great improvements for patients, and again, it's shown in the research to be a very powerful tool for treating meibomian gland dysfunction specifically and helping resolution for dry eyes. So again, something to think about. Please let me know again for anybody who's catching us live or in the replay, if you've had IPL done, if you had success with it, how many rounds did you do? I think that's always good information. One thing I've talked about in a few videos recently, and we'll even have a video coming out next week going in depth on low-level light therapy or red light therapy. This has been around for, well, technically red light therapy has been around for a long time, even since like the late 60s when it was sort of discovered and invented. But it has been getting a lot more attention as treatments for various conditions on the body, but even for dry eye disease. The idea is that low-level light therapy does induce this photobiomodulation effect. It doesn't have all the wavelengths of light that are being treated with IPL. IPL, again, is polychromatic light, so it's many wavelengths, where low-level light therapy is usually just one specific wavelength or maybe 2 or 3. And so this usually doesn't cause as much of a thermal effect, but what's nice is that low-level light therapy is usually safer for the eyelids, specifically the top eyelids, where IPL treatment directly to the top eyelid is largely considered unsafe. Also, people who have darker skin complexions may benefit from low-level light therapy, where an IPL treatment may be unsafe for someone with darker skin complexion because it can basically zap the melanin in the skin, and that's something we don't want to do. But research, again, we're having a video next week going deeper into kind of the research findings of low-level light therapy and how that can help some people with evaporative dry eye disease. One thing I wanted to mention here, and I haven't done too much, I would love to do a video on this. Let me know if you would like to know more about this. This is called Meibomian Gland probing. This has been around for over 10 years now. This is something I even knew about when I was a student, also known as masking probing. This is a procedure where a small microscopic needle is pushed through and basically opens up the meibomian gland that maybe has been blocked up or keratinized. So if a gland has been blocked up, sealed, no oil is able to come through, but we can see the gland is still there, then this procedure may be used to open it back up. The one thing that I think a lot of doctors maybe refrain from doing meibomian gland probing is because it does cause some discomfort. A lot of times, numbing medications are used to numb the tissues because people can feel it and you can even hear it. That's part of the procedure, is that these glands are so plugged up that when you're pushing and breaking into it, it's audible. You can hear it from across the room. And this is believed to be due to some fibrosis of the glands themselves. And so I know a lot of dry eye specialists who, if a patient does like low-level light therapy or maybe IPL and the oils just aren't coming out after they've been heating up those glands, then they know, okay, those specific glands that aren't opening up, we have to do mask and probing on those. And so as more research has come out with meibomian gland probing, I've seen a lot more dry eye specialists kind of jump on the bandwagon of offering this and finding success with it. And we'll talk about that in just a little bit more. People always ask me, hey, can you regrow the meibomian glands? If they're gone, if they've atrophied, is there anything we can do? Unfortunately, it's largely believed right now that there isn't anything available for us to regrow them back. There are some more in-depth, I think in general, more in-depth studies are needed, but there are a few studies. And so I did put here on the screen, and I'll try to link them below as well. But I put the PMID here, which you can type in those numbers over on PubMed if you want to research it yourself. There are some investigational medicines that are showing some benefit to regrowing meibomian glands in mice. There is some publications on thermal pulsation, as well as IPL and low-level light therapy is helping meibomian glands kind of revitalize, as well as some in the meibomian gland probing arena. And so I just wanted to add that as some additional reading if you're really interested. Right now, though, I can tell you from reading them, a lot more studies are going to be needed before anybody can claim that they're truly regrowing meibomian glands back. So right now, I think that's why so many doctors are focused on encouraging, hey, we need to intervene earlier. We need to be more proactive about cleaning the eyelids, doing compresses, as well as just evaluating and catching meibomian gland atrophy sooner so we can start treating it before it truly dies off and becomes a problem. So again, that's my main presentation for this evening. Thank you guys so much for being here and all your support. We're going to shift into the live Q&A. So please, for everybody who's here catching us live, drop some question marks, your question. Try to put in a bunch of question marks before and after so I can see it as the questions come through. I always like to give a disclaimer that I cannot give you personal recommendations for your treatments. I'm not able to give a diagnosis through online appropriately because I believe truly you deserve the very best care, and that's going to be with a local eye care professional. So always talk to a local eye care professional for a proper diagnosis and treatment. But for all of your questions you may have, I will do my best to answer them in an educational manner so that everybody can learn and take better advocacy for their eye and vision care. With that, I do want to say a huge shout out and thank you to all of our channel members who support us. Our channel members not only get an kind of opportunity to help choose the topics of these live streams every single month, but they also get priority in the Q&A. So I will be jumping around trying to prioritize all of our channel members who are asking questions. Thank you so much again for everybody's support and for being here. With that, let's jump into some Q&A. I do see some questions coming through. This one comes from Yufu Joe. Thank you so much. It's great to have you here. It says, does getting good blood flow or metabolism help with tear production? It is believed that yes, having improved blood flow, because that's going to bring nutrients and oxygen and other nutrients to the tissues, both the main lacrimal gland as well as the accessory lacrimal glands and the meibomian glands. That's going to help keep them young and healthy. As far as getting good blood flow to those areas, there are some kind of homeopathic thoughts that getting heat just generally to the eyelid area, such as doing warm compresses, may encourage blood vessel dilation and getting more blood flow to those areas, as well as having regular exercise, getting good sleep, and eating healthy, taking supplements, those sort of things. Those may help. But in general, yes, good blood flow and good metabolism may help with tear production. So thank you for that question. This one is a question from I'll say S. Banerjee. Can dry eyes result in glaucoma? So thankfully, no. Both dry eye and glaucoma, very different conditions on the eye. Glaucoma is where the nerve in the back of the eye slowly dies over time, or in most cases, it slowly dies over time. But glaucoma can occur for multiple reasons. There's almost like over 65 different types of glaucoma. But thankfully, dry eye, different part of the eyeball, and not directly connected. However, some medications, as we mentioned earlier, can contribute to meibomian gland dysfunction and dry eye disease. But I'm thankful that because if people did have, for how many people have dry eye, that would mean a lot of cases of glaucoma if that was the case. Barbara, thank you again so much for being a supporting member here. Where can you get a hot mask that stays hot? So there are like 300 different types of warm compress masks that I've seen. I've had companies send me out sometimes for me to try. There are some that are USB connected that either plug into the wall or maybe to like a computer. Those ones usually have a timer on them. But I have had some patients tell me about ones they've found that don't, that just they plug in and it stays warm all the time. Now, I can't necessarily, I haven't seen any research to recommend that would be the recommended case. Most research suggests somewhere around that 5 to 10 minute mark, at least once a day. I have had some patients who do it more frequently, maybe two times a day. But as far as one of them I could recommend, I personally don't know any brand I would personally recommend that's like one of those plug-in ones. But I've been investigating some different ones, and maybe in the near future, I'll do like a full breakdown of all the different brands I've seen and which ones I think are better versus kind of pros and cons. But usually you can always ask your local eye doctor if they have anything. Otherwise, there are many different brands you can find online. If anybody has a recommendation for Barbara, again, drop those in the comments section below. Thank you. I'm going to skip a few here just because, again, we have some members who are asking for some priority here. Val asks, are there any tools you recommend for monitoring eyes and zooming in at home without a slit lamp? So again, slit lamp is the microscope we have at the clinic. At home, it's tough. If you do have one of those strong magnifying like makeup mirrors, I have tried to use those myself, but usually they don't get enough magnified where you can really see the glands. There is an at-home handheld device that I've showed a few times in some other videos. I believe it was purchased by a company called Avanova, and they may sell it on the Avanova website. I'm not 100% sure, but you can check it. But that's a small handheld device really for checking for blepharitis of your eyelashes. But you can... I have one, and it has a little light that you can press and hold up to your eye, and it's really a concave mirror. So you can magnify, and you can see the edge of your eyelid. And I've held that and pushed just gently on my lower eyelid, and I can see if my oil glands are pushing out and releasing some oils. Now, I do encourage, if anybody wants to try that, don't want to push too hard on the eye. When pushing and on the eyelid, doing an eyelid massage of any kind, you don't want to push too hard on the eye because that could cause damage to the eyeball itself or raise the eye pressure. And so if you are considering doing a warm compress and an eyelid massage afterward, I have done a video on eyelid massage. And so something just to be considered. You want to be very gentle with the eyelids. But that might be something to look into, Val. Thank you. Banerjee, thank you. Does dehydration cause dry eyes? Dehydration does play a role in dry eyes. There have been some studies that suggest, yes, people who don't drink enough. In fact, I'll get a drink right now. There are some studies that suggest people who don't drink enough fluids have higher rates of dry eye disease. But then there are some interesting studies that even go the other way. I've read one study where they looked at a retrospective collection of data and found people who reported drinking more fluid had more severe dryness. It was sort of a paradox, and you can find research, honestly, to support any direction you're looking for. But it is largely believed that, hey, trying to drink more water is a good thing for dry eyes. So I do encourage people just to be aware of their fluid intake. Of course, you can drink too much, but to be aware of that. There are some companies that are developing like the dry eye drink, as there's thoughts that just drinking straight tap water or water without electrolytes in it maybe doesn't do as well as getting into the tissues. And so they are doing some research trying to find the true benefit of taking those sort of like dry eye drink and other electrolyte mixes. But something to think about. Again, I got a couple other questions here. Katori, causes of non-MGD dry eye syndrome. So we did do a video a few months back going more in depth on the whole vicious cycle of dry eye beyond just Meibomian gland dysfunction. And certainly there's many different factors that go into it. The biggest ones that I see, certainly Meibomian gland dysfunction is a huge player in there. I do see a lot of people, I can't say a lot, but I do see quite a few people with some associated autoimmune condition, such as Sjogren's disease, if you've ever heard of that one. This is where autoimmune cells damage not only their salivary glands, but also their lacrimal gland. And so they end up with really dry mouth and really dry eyes. That's something that I maybe am diagnosing more because I'm specifically looking at it because I see a lot of patients with dry eye. Inflammation plays a huge role in dry eye too, and that's why a lot of medications are geared toward not only are we testing for inflammation in the clinic, but we're also, a lot of medications are now geared toward treating the inflammation to shut off the inflammatory vicious cycle of dry eye. So inflammation also plays a big role in that. But I would encourage, if you haven't checked out that previous video, it's like another full hour long lecture, but it goes really in depth into the different various causes of non-MGD dry eye syndrome. So again, I will have some links in the description. Just want to make sure we're doing good. Let's see. Sorry, I had to go back here to make sure I'm catching people's questions. So this is a good one. Thank you, Zed, for asking this question. Thoughts on potential side effects or scarring caused by the masking or Meibomian gland probing? So historically, there has been some criticisms and concerns that not only, with masking probing or the Meibomian gland probing, that not only does it cause discomfort, it's a bit painful. And so that's why there's so much that goes into numbing the eyelid tissues. But that there's thoughts that since you're forcefully breaking through this keratinized tissue, that it could induce scar formation and make the glands worse. That has been a theory. However, more recent publications, and I did put one in the actual lecture here. If you saw if you want to scroll back, I have those slides that include that a reference to the masking probing. Let me see if I can pull it up here. This one here on the screen, if you want to read that, there's that actually goes into that P mid there at the bottom. That actually goes into how it doesn't cause scarring, but actually helps with the regeneration of the Meibomian gland. So there seems to be some conflicting new evidence. And so that is something I think historically has been a concern, but more recent publications, and it's not just this one, there's actually several, but this is probably the most prominent, most recent one. But then they do suggest that it's not scarring. But I think the biggest potential side effect is not only, well, just pain during the procedure and then some bleeding afterward. But I think that's probably the two biggest things that people are concerned about. Yep, there, man. I'm back. um, and Banerjee asks again, can using a hot mask 5 minutes every day help? So the minimum that's recommended by most doctors and in the research is at least 5 minutes, around 4 to 5 minutes at the very least. But somewhere around 10 to 15 minutes is typically considered to be a lot better. Vic asks, have you seen recommend fish oil before for dry eyes? Like, why is this? So there is a lot of research and debate into the use of omega-3 fish oils for dry eye, mainly because it helps reduce inflammation in the body. And this helps to reduce dryness and helps improve tear production. Again, inflammation plays a huge role in dry eye disease. The vast majority of research and even more recent clinical reviews have largely shown that, yes, there is support that omega-3s help, but again, it's debated and there are some evidence that go the other way. However, I think for a lot of people, omega-3s have other benefits, certainly for joint pain. There's some benefits for heart health in a lot of research, and then certainly for even retinal health and some brain health capacity too. So I think it is something that can be beneficial. I've personally gotten more into using omega-3 blood testing for myself to know where that is. And we covered that a little bit more extensively in our last month's episode on various supplements. So I do encourage you to check that one out. We only have a few more minutes, and so I'll see if we can just make sure we're not missing anybody who's supportive, a supporter for our channel. Saying thank you, Joe, UFO Joe. Thank you so much. A question from JT: is tea tree oil safe for the eyes? There's a new OcuSoft that doesn't require rinsing. OcuSoft in general, if you've never heard of that, is a brand of eyelid cleaning wipes. They have been on the market for a long time. They do have several different types of OcuSoft wipes. There is a few that don't require rinsing. Those are usually the advanced kind. I'm not sure if the baby formula for OcuSoft requires rinsing or not, but I know some people who really love the texture and how soft that is. Their tea tree oil, in high doses, tea tree oil has been shown to be effective for not only helping kill off some other microorganisms, but Demodex mites as well. Although it's off-label, that has been shown in research to help with Demodex. The problem with tea tree oil is it burns at a high dosage, and over 5%, some people have allergic reactions to tea tree oil. There is one study, and I did kind of a review video about this study, but there's one study that looked at the active ingredient called terpenin 4-ol. That's the active ingredient in tea tree oil, and their conclusions that potentially it could be contributing to Meibomian gland dysfunction. However, my criticism of that study is that they used a high dosage of terpenin 4-ol and basically treated a petri dish of Meibomian gland cells for an extensively long time. And most people aren't putting tea tree oil on their eyelids for like 15 minutes or 30 minutes or an hour. People are using it for seconds because they're using that lid wipe and then it dries or they wash it off. And so I don't think that study was clinically applicable. There are some professionals who do say, hey, that's enough evidence for them to say, I don't want to recommend tea tree oil. But most products, including eyelid wipes, most of them that are out there now, have like 0.00, like 4% of tea tree oil in them. So it's a very low amount and probably not significant to contribute to Meibomian gland dysfunction at this time. But again, some people are allergic to tea tree oil, so it's something to be cautious of. Again, thank you guys so much for being here. I do have to take off for tonight and catch another meeting. Thank you so much. We'll be jumping on hopefully next month on another topic, so please stay tuned. Thank you so much. Again, drop your comments and questions below. I'll be trying to prioritize getting to everyone's questions on this video for going up for this next week. So thank you so much. Hope you have a great night, and we'll see you in that next one.